Good morning, doctors. Welcome again. Today we are going to discuss about UPSC paper part 2. It's a B section in 2017. Part 2 A section I already discussed 10 MCQs and these are the next 10 MCQs. Let's start. Which of the following is not a correct for strawberry gallbladder? It is a malignant condition of gallbladder. No, this is not a malignant condition. So answer is A. But it has some mucus aggregation of cholesterol crystal. True, it may be associated with cholesterol stones, and simply cholecystectomy is treatment of choice. So B, C, D is right, but here the answer is A. Strawberry gallbladder refers to surface appearance, not shape of the mucosa of the gallbladder, due to multiple small collections of triglyceride cholesterol crystals and cholesterol esterase. With the lamina propria of gallbladder, the wall of gallbladder wall cholesterolosis. It may be associated with cholesterol stones. Strawberry gallbladder present a common idiopathic non-neoplastic condition. Laparoscopic cholecystectomy is the treatment of choice in these patients. Okay, now treatment of choice for recurrent thyrotoxicosis after surgery is by radioiodine. C option. Recurrent thyrotoxicosis after surgery, in general, radioiodine is the treatment of choice, but antithyroid drugs may be used in young women intending to have children. Further surgery has little place. So, diffuse toxic goiter, initial course antithyroid drugs with radioiodine for relapse. Toxic nodular goiter, large goiter treated with surgery, toxic nodule surgery or radioiodine, and failure to previous treatment with antithyroid drugs or radioiodine surgery of thyroid ablation with radioiodine 123. Okay, all the following are features of polycystic disease of kidney except erythrocytosis. So we found in polycystic kidney disease hematuria, hypertension and renal failure, but no erythrocytosis. Okay, so D option is the right here. Explanation in front of you. Which one of the following is the most important selection criteria for obesity surgery? Answer is BMI is more than 40. It's a morbid type. So this is a criteria of obesity surgery. A option is the right. Bariatric surgery may be an option for adult who have BMI more than 40 or more. If BMI 35 or more, seriously health problem linked obesity such as type 2, heart disease or sleep apnea, then recommended. BMI 30 or more, serious health problem linked obesity, gastric band only. Minimum to 5 years of obesity, failure of conservative treatment, no alcoholism or major untreated psychiatric illness. Avoid if likely to get pregnant within 2 years. Age limits 18 to 55 relatively. Okay. Now, a 55 years old underwent abdominal rectal prolapse surgery. At present, he complains of sexual dysfunction, which is probably due to the injury of pelvic autonomic nerves. A option is right. Let's discuss. An abdominal rectopexy has a lower rate of recurrence, but when the patient is elderly or frail, a perineal operation, sometime performed under spinal anesthesia, is usually safer, as an abdominal procedure risks damage to the pelvic autonomic nerves, resulting in possible sexual dysfunction. A perineal approach is useful preferred in young men. Okay. In endoscopic retrograde cholangiopancreatography, endoscope used is side viewing. Its B option is the right. Endoscopic retrograde cholangiopancreatography, or we can say ERCP, performed is using side viewing fibro-optic duodenoscope. The ampulla of water is intubated and contrast is injected into the biliary and pancreatic duct to display the anatomy of radiograph. Double duct sign is seen in pancreatic carcinoma and carcinoma pancreatitis, dilatation of main pancreatic duct and pancreatic contractures Duct with stone abnormalities of pancreatic duct side branches are seen. Okay. Oliguria is defined as it's 600 ml to 700 ml of urine excreted in a day. C option is the right. Now, oliguria is defined as a urine output of less than 400 ml per day, the minimum amount of urine that a person in normal metabolic state exits to excrete or get rid daily solute production. It's less than 300 ml of urine. D option is right here, not so less than 400. It's 300 ml, not 600 to 700. So this is oliguria. Okay. According to Harrison, oliguria refers 24-hour urinary output less than 400 ml, and anuria, complete absence of urine formation, is less than 100 ml. Okay. So answer is D. A 40-year-old man with a history of reducible left groin swelling of 2 years comes with severe pain over left groin. The swelling is now non-reducible and very tender to touch. Most probable treatment plan for this patient would be prepare for emergency surgery. D option is right. Yeah, let's discuss. Irreducible hernia may progress to strangulation and possible bowel infarction. Open surgery is preferred when a hernia is irreducible or there is any risk of bowel resection. Treatment of inguinal hernia: men with asymptomatic or minimal symptomatic inguinal hernias without or minimal complaints consult conservative management. Inserted hernia, no strangulation symptom, try reduction. Strangulated hernia, emergency surgery. Symptomatic inguinal hernia, elective surgery. Women consider femoral hernia, consider the periperitoneal endoscopic approach. Okay. During laparoscopic inguinal hernia repair in a triangle of doom, the following are true except base by iliac vessels is not. So C option is the right. Okay. All are rare type of lateral hernias of abdominal wall except obturator. They are asking a rare type. So, obturator hernia, it passes through the obturator canal, occurs 6 times more frequently in women than in men. Most patients over 60 years of age, the hernia have often undergone strangulation, frequently to Richter type. The present time presentation, they are located to the groin. So, guys, I hope it's clear for you. And if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. And if you like this video, please put like on it. And thank you, good day and goodbye. And if you still not subscribe my channel, subscribe it.